We're going to be discussing the preparation of Tropican Hand-Feeding Formula, but before we get into the preparation, we need to discuss how it can be stored.
Which is very important because unfortunately a lot of improper storage methods lead to health concerns with our chicks when they're being fed this optimal nutritional diet. Mm-hmm. So it's very important that we highlight a few of the recommendations that we make.
Right. If you were to purchase it, it would be good to purchase it in a bag that gives you about a month's worth.
Yes.
And you could take some of it and put it in a sealed container, airtight container, which would be really important. You can keep that in your nursery, and you can seal the bag up and put that in your fridge for storage.
It's very important that you say that you mentioned that we need to seal up the bag again before returning it into the fridge. Mm-hmm. Very important as well that the container that we use in the nursery is vermin-proof.
Yes.
And insect-proof as well.
Yes.
And that there's no humidity that can go into it.
Right.
When it's warm temperatures, this can become a huge concern for bacterial and mold that can enter into our food.
Right. An important thing to note as well is if you're removing that big bag from the fridge, it's important to let it warm up before you open the bag.
Yes, back to room temperature before we open up this larger container or bag, and this is also going to prevent from the warm air from jumping into the bag.
Yes.
There's a lot of probiotics in there, this very, very high caloric and nutritional food, so obviously everything that is called bacteria, fungi, or pathogens can go right into it. So we need to keep it clean, for sure.
Exactly. It's also very important not to put any wet utensils into the airtight container.
This is something that we're tempted to do sometimes when we're preparing our food, but it's very important that we always use a dry spoon to go in there to get our food. Once the hand-feeding formula has been exposed to water, then it shouldn't be reused.
Right.
And so this can become a contamination factor as well. It's important, Suzanne, too, we favor using the glass containers to using plastic containers because we can actually see the food.
Yeah, you can see what's going on, if humidity has entered it or not.
And we also try to always remember to empty out the whole jar before we refill it up again. And of course the importance, Suzanne, with a lot of our customer service that we do and with the follow-up that we do with our food, it's very important that we write the lot numbers down.
Yes. And also check the best before date, which is not the same as the manufacturing date.
No, that's very important. Both dates are inscribed on our hand-feeding formula bags that are purchased, and it's very important that you look at both numbers and keep track of those best before dates and expiration dates. But also it's important that you keep track of the lot numbers.
And that can be included in the chicks file.
Absolutely. In our chicks growth file, there's always a place to write down the lot number, and we definitely encourage all our customers to do so.
We just spoke about how to store the Tropican Hand-Feeding Formula, and right now we're going to discuss how to prepare it. There's actually no need to actually weigh the food out.
No, it's so simple to just measure it using a simple measuring cup, or you become familiar with the same spoon and the same quantity of food that we give. And it's very easy to reach a consistency visually, and when we're mixing it, we can feel it, that there's no harm if there's a little bit of variance in the consistency from time to time. The nutritional value of Tropican is so optimal that we don't need to be that precise with the dilution.
Right. There are actually two types of dilution that we would be using. You would use one which is more diluted, and that would be for the hatchling.
Yes.
And we would use one that's a little bit less diluted, and that would be as the chick enters its growth phase.
Yes, and this is very important. This usually starts at about the 4th day of age, after the chick has been in a logarithmic phase, not really gaining 10% of his weight, and then it enters the logarithmic phase where then we're expecting the 10% daily weight gain. Right. This is when we would be using the dilution, which is a very simple one, 2 times, a little bit more than 2 times the amount of water compared to the food, which is simply put into milliliters for you, 125 milliliters of food, or half a cup with 260 milliliters of water. Now that's changed a little bit from the past.
Yes.
Yes.
With our new hand-feeding formula that we have out.
Yes. The new hand-feeding formula is a little bit more potent, and it's a little bit more concentrated, it seems. And so we've just recently revised our instructions to using 260 milliliters versus 240 because we were getting a little bit more difficulty mixing it in. Mm-hmm. Now, of course, with this new extruded hand-feeding formula, we have barely ever encountered any difficulties mixing the food. And this is an added bonus to our optimal diet that we offer in our hand-feeding formula.
Here we have a picture of mixing the hand-feeding formula. We have the correct amount of water, we have the correct amount of hand-feeding formula, but we are using a terrible technique.
Horrible technique, and this will lead to a clumping.
Right, we're adding the water very gradually while we're mixing.
This is not recommended. Perhaps this is the way you can bake a cake and prepare the cake formula, but it's not the way you should be doing your hand-feeding formula. What we recommend is that the complete amount of water that you need to add to the amount of hand-feeding formula that you've put into your container needs to be added all at once. And then you start mixing with a fork,
Yes.
not a spoon. Very simple details, they're very subtle, but they make all the difference in the world.
Exactly. The temperature of the water is also very important. It's
Yes.
important to note that we don't say hot water, it's warm water that we're using,
Yes.
just a little bit warmer than what we would be feeding.
Yes, and we'll be discussing that in further sessions about the temperature required for various chicks, age. But in this particular segment, what we wanted to emphasize also is if you're using this technique, then you're probably cooling down the formula as you're mixing because it takes longer to mix.
Right.
And then for sure you're going to get some clumping.
Contrary to the previous picture, this picture shows how to properly mix the Tropican hand-feeding formula. So the full amount of water has been added to the formula and then it is mixed.
Yes, of course. And this is very important to mention as well that at this point we're not finished mixing it. So eventually when it is thoroughly mixed, it will look in a few seconds like applesauce.
Exactly, and it's important to note that it does not separate out once it is mixed.
No, and this is a very important property of our hand-feeding formula. A lot of quality control is used to ensure that once the hand-feeding formula is prepared, it does not separate out either in the mixing container or in the bird's crop. So this is tested at our pet food plant laboratory, and it is also tested at Harry in our nursery prior to feeding even the first sample of every lot that we test.
So here we have the applesauce consistency that we were looking for. And the fact that it doesn't clump, the hand-feeding formula doesn't clump, is really good for us at Harry because we use these syringes with small tips.
Yes, that's very important. It's a preferred hand-feeding technique. As we mentioned prior, it prevents deviation of the beaks, and it's also what we prefer to prevent trauma inside the mouth. Now, also important to mention here, Suzanne, that in this photograph, we're using a specific quantity of food with one syringe. Therefore, we're assuming that we're going to be feeding one chick or perhaps a clutch of chick. But it's very important to mention that if you're going to be dipping back into your hand-feeding formula preparation to refill your syringe, then we must minimize.
That's right. We don't want to do any cross-contamination between the different clutches.
Exactly.
This photo shows how we would prepare syringes of hand-feeding formula if you were to feed several birds of one or more clutches.
Yes, and this technique is much more time efficient, we feel. So we have a lot of syringes ready to go, and this also gives us more time to actually feed the birds because we're keeping the syringes in a warm water bath.
That's right. It's important that it is warm and not hot.
No, and of course this is not without mentioning that the food will still be tested on your forearm ideally. Some people like to test it on their chin, some people like to actually taste it. It must be always monitored nonetheless, but it's important to say that this will allow us to have more time to feed different birds. And this is preventing us from double dipping.
Exactly. One subject that we need to talk about, and it's a controversial one, is the temperature at which we feed the hand-feeding formula.
Yes, it's never been controversial for us at Harry because for the past 20 years we've been feeding at a very warm and not hot temperatures. The fear of causing thermal burns was originally the reason why we habituated ourselves and became very comfortable with our feeding conditions and our techniques. But it is one that we repetitively have to educate caretakers about. And it causes a lot of concern for avian veterinarian community because the chicks being exposed and fed high temperatures when they're young may develop chronic candida when they're older. And the exact consequences of feeding these birds too hot is not yet known, but is definitely being explored right now.
It is. Something that is overlooked sometimes is that maybe the temperature and the humidity of the brooder.
Absolutely, and this is usually somewhere that the caretaker forgets to look at. So they're quick to assume that perhaps the chick was fed too cool, but then they fail to realize that the humidity or the temperature wasn't adequate for that species or that age that the chick that they're trying to feed. Mm-hmm. And this is very, very important, and that's why using the chick log on a daily basis allows you to monitor and write down the temperature of the brooder, the humidity of the brooder. And all of these factors will help you determine whether your feeding strategy and the temperatures you're feeding at are adequate for that chick's health.
Exactly. You mentioned that it can cause thermal burns.
Yes.
That is a very important issue. It can also delay the weaning process.
Absolutely. We don't really know how that works together. We're quite confident that when we're feeding warmer, we're regressing the birds. Sometimes we wish to do so if there's been some kind of an event in that bird's life, perhaps, that the bird is okay to be regressed and it's being closely monitored, but we don't want to be doing this unconsciously. And additional to that, we fear that there's a lot of concern for thermal burns, but many people fail to realize that the superficial burns that will cause the inflammation of the crop, that will cause also the birds to have a little bit of pain inside of their mouth. And this is also very, very easy to notice because most of the time when we feed the birds a little bit too warm, they're going to open up their wings, and they're maybe also likely to do a lot more post-feeding regurgitation, which is normal, we know, when they reach prior to the fledgling age, when the pin feather stage starts to arrive. Then they're going to start a little bit of post-feeding regurgitation, and that can be normal. But if they do that at a younger age, it's usually a very determining factor that your hand-feeding formula was too hot.
In the past, it was often recommended to feed at much hotter temperatures, maybe 103, even to 105. And if you go into the literature right now, you can still see some of these recommendations.
Yes, and what was in the past was for a particular reason. These were days prior to hand-feeding formula being manufactured as extruded diets. If we're always trying to mimic what the female hen is feeding her chicks, but prior to the days where we had the digestive enzymes, and the highly digestible diets that were offered to the chicks, we had to rely on a higher temperature in order to ensure crop motility and digestibility.
Right.
Now, it's been several, almost 2 decades now, that our hand-feeding formula is very highly digestible. And we feel, and we've always felt very confident, that we don't need to go higher than 98 to 100 degrees in our nursery when we're taking care of logarithmic growing chicks in the nursery.
Exactly. And during the weaning stages, we would even decrease this temperature.
Absolutely. This is part of our early parrot education protocol and our strategy, and we definitely use temperature going down to encourage the birds to start eating more of the dry granules and to start eating the soaked pellets in their food. Mm-hmm. And this is very, very important. Psychologically, we think it's important, but also for the health of the crop. And in addition to that, we have to mention, though, that when the chicks are hatchlings, then we might recommend to go up to closer to 102, 103. Right. But this is for a very, very small few days. Mm-hmm. And again, there are numerous breeders that have success with just playing around with a healthier environment in the brooder, and then being careful not to overheat the newborn chick.
In this segment, we are going to be discussing the different hand-feeding techniques that we use here at Harry. Now, of course, this is different when we consider a chick that's a neonate or whether it's a chick that's embarking upon the weaning process.
Definitely. In the neonatal stages, of course, we'll be using the smaller pipettes and then graduating to the syringes and eventually incorporating also the spoon-feeding techniques during the weaning stages.
Josee, I don't think we can talk about different hand-feeding techniques without discussing the skill of the hand feeder. This is not for the novice caretaker. No, and unfortunately, the intention of these video segments are definitely not for the future caretaker that wishes, unfortunately, to purchase a pin feather stage macaw. We definitely don't encourage that, and we feel very strongly about the fact that this is a specialty item. Our hand-feeding formula and all the techniques we'll be sharing are intended for the aviculturist. That's right. Or perhaps for the future veterinarian practitioner or technician that wish to cater to the avicultural community and, of course, treat neonates. We definitely encourage that everyone gets mentorship, for sure. Exactly. This is extremely important because there are several issues that can occur with the novice caretaker, such as aspiration, feeding too hot and having burns, just insufficient amount of food being fed. Or the frequency as well. Exactly. Birds can become dehydrated as well and have less crop motility and therefore have crop
disorders that can result into some severe health concerns. Therefore, we will be touching upon several of these health concerns, and unfortunately, some of the mishaps that can happen throughout the growth of a chick in a nursery individually. But for the purpose of this series, we're definitely only talking about the techniques, pros and cons, and of course we'll try and put in as many cautions as we can throughout, but we're definitely stressing that this is for the professional aviculturist. In discussing different hand feeding techniques for feeding chicks in our nursery, there can always be a discussion about the pros and cons of every technique that we use.
For sure. We're going to be discussing the advantages now of using syringes. And syringes are something that we use a lot at Harry because it's very easy to quantify. It's easy to monitor the amount that is fed to the chick.
Yes, and this is very important as on a daily basis, part of the routine monitoring of our chicks include writing down in the chick growth chart or in the chick weaning chart the quantities that were actually fed at every single meal. So allowing us to use the syringe will make it easier for us to actually quantify and make sure that we write exactly the amount that was being fed to this chick.
Exactly, and this is very important for Harry as we are a test trial feeding facility.
Yes, since every single lot of our hand feeding formula needs to be approved in our nursery, we're expecting usually during the logarithmic phase a 10% daily weight increase, and so therefore it's very important that we're evaluating if these chicks are reaching that 10% goal, that they are being fed the quantities they should be.
Some other advantages to syringe feeding include the fact that it's a lot faster.
Definitely, and especially if we have quite a number of individuals in our nursery, this is very critical. But even if we have just a few individuals, it allows us to have more time to do the early parrot education, and it also allows us to make sure that the chicks are being fed and can then be monitored for crop motility. The chicks won't get hypothermic because they're not taken out from their brooder for a longer period of time. So there's numerous health benefits to also feeding chicks in a faster technique.
It's also cleaner. It's cleaner for the chick itself, their beaks, their feathers stay cleaner, and it's also cleaner for the chick pen.
This is very important, especially when we're raising chicks in warmer climates. We definitely don't want to have hand feeding formula that sticks around in the chick bin, because then this can become also pathogenic for the chicks, and we'll have a lot of bacteria and fungus that will grow. So we want to make sure that our bedding is always perfectly hygienic, and we also want to make sure too that the feathers around the mouth will not stick. And we know that our hand feeding formula, the Tropican Hand-Feeding Formula, has amazing virtues for that because it doesn't stick onto feathers.
That's right.
Mind you, we have to clean them after we feed them.
Yes,
for sure. We also usually recommend that people take a little bit of hot water on the tip of their fingers and just make the birds bop so that we can actually clean out the mouth as well. And this is particularly important for some of the lory species that are being hand-fed with a syringe.
Another advantage of syringe feeding is it allows us to feed at a cooler temperature than we would if we were spoon feeding.
Yes, and of course the benefits of feeding at a warmer, cooler temperature instead of it being hot is a debate in itself, and it's something that we will be doing a separate video podcast on. But allowing us to rely on the feeding response of the chick, based on the fact that we're going to be using our fingers, ideally wet and warm water, and pressing down on the commissures, then we're not relying on the hot formula to be in the syringe to stimulate this response. And so this is a very, very important benefit that we find, because we don't experience thermal burns at Harry. We actually rarely use thermometers too in our hand feeding formula, and this is a lot of agriculturists would be frowning upon us, but we don't feed at a hot temperature. It's very rare that we'll ever go higher than 100 degrees Fahrenheit. And therefore, this is one of the techniques that allows us to be able to feed at this temperature.
In addition to allowing us to measure the quantities being given, another advantage of syringe feeding is the fact that we can add therapeutics to the hand feeding formula.
Yes, although the hand feeding formula is complete and there's no necessity to add anything to this hand feeding formula for optimal growth, there may be situations where gut enhancers need to be added for increased motility, such as aloe veras or apple cider vinegars if we need to acidify the crop in case there might be a potential risk of candida. Definitely at Harry we don't use antibiotics and antifungal drugs. We choose not to use them, But nonetheless, when we do use, as mentioned before, the aloe vera or the apple cider vinegars, we want to make sure that the quantities being given to the birds are specifically written down in the bird's file, because we're always trying to see what seems to have the most therapeutic effect. And so therefore, having a syringe with a clearly visible graduated quantities on it allows us to make sure that we're able to quantify this and record it in the bird's chick file.
Another hand-feeding technique that we use at Harry is using these micro-tipped pipettes.
Yes.
And these would be used for the hatchlings for the first few days.
Yes.
An important thing when using these pipettes is that the tip would be cut. And of course, we wouldn't insert the pipette right into the mouth. It would just be resting on the side of the beak.
Yes, because newborns can also get the beak trauma. And the mouth trauma, actually, if there was the insertion of this even very fine microtip.
Right.
These are used usually for the first 2 days, Suzanne, because they're really hard to quantify how much we're actually giving to the birds.
Exactly. We would pretty much go by the number of drops that we would be
Yes,
giving.
and usually hatchlings, unfortunately, if we have to take care of hatchlings and the parents are not raising them, these are usually incubator raised chicks, and we have to use these microtip syringes until the birds give us the stronger feeding response to then allow us to use a simple syringe.
Right. Another disadvantage of this is that it's very difficult to disinfect.
Almost impossible to completely thoroughly disinfect.
Yeah.
So we usually use very warm water to clean them out. But because we can't go into the pipette and brush them, we have to make sure that all the food has been cleared out before we actually use a cleaning detergent such as Oxyfresh cleansing gelée in our syringe bath. But we cannot also use a stronger Virkons or stronger disinfectant with these because the plastic is too thin.
Yes. And even if it were disinfected properly, it would not last that long.
It wouldn't last, and they would fall apart and they break open at the seams. And additional to that, we're always fearful that they would be absorbing, the toxins from the disinfectant. And so usually they're discarded after 2 days in our nursery. And since they're only used for hatchlings, and we don't always have hatchlings, then we're not using a lot of them. And yes, they're a little bit more expensive, but then again, we're compensating by using very sturdy syringes for the duration of the bird's stay in our nursery afterwards, and so it's not such a huge cost investment.
The pipette that you're holding in your hand is not necessarily one that we would use at Harry for an older chick, but there are some aviculturalists who would use this.
Yes, and we choose not to use them for specific reasons, that they're very difficult to quantify how much we've actually fed. It's not very clear. I'm getting old, and sometimes in a nursery environment, especially the lights are very dim. So we prefer to use the syringes that have colored markings on them.
Right.
Simplifies our life, of course. The other reason also, Suzanne, we mentioned before that they're very difficult to ensure the cleanliness of them.
Exactly, they're very difficult to disinfect.
And even the bigger ones. And so the food would often stay here and they're hard to rinse out. I don't think they're time efficient at all. They're not necessarily more cost effective as well because they will not last in our disinfectants. And so I don't really see the purpose of using them unless unfortunately you cannot have access to our favorite 20cc syringes with a small tip, right?
Right.
Because the tip size is the same for these both. It's just these are very difficult to find.
Although there are many advantages to syringe feeding, there are some concerns that we also need to discuss.
Yes, and as we become skilled hand feeders, we must never forget that these concerns are always there. And some of them actually become more and more of an issue as we become more confident with our technique and faster at the technique.
Exactly. We can actually feed too much and
Yes.
damage the crop.
Yes, and this is something that we can minimize by using smaller syringes or using syringes that only allow the volume of the crop capacity to be fed in one shot. Let's say we would be that fast, which is not something that we definitely preach, but it's something that we have to be very intuitive to. Definitely the main concern as well for the health of the chick is that there can be associated aspiration risk with syringe feeding.
Exactly. This is particularly important if the hand feeder is not skilled.
Yes, and usually this will happen if the hand feeder is not patient enough to wait for a chick response, a bopping response, and this is very important because this allows us to safely syringe feed a chick. Of course, there are some times where the chicks are getting older that they will no longer give us this bopping response. But it's very important that then we become very intuitive to see, first of all, if we can encourage this kind of reaction in another way. Maybe the bird is getting hypothermic, maybe the bird is not comfortable, maybe the bird is slipping, maybe we're being too firm with the bird. But all of these different factors will make it harder for us to feed the bird safely.
Another consideration is that some people feel that it's not really natural, it's not really nurturing for the bird.
Yes, well, of course, all of the techniques that we use in a nursery are not natural.
No.
And the best way to feed a chick is having his parents feed the chick. And we definitely encourage all the breeders that can do this for the longest period of time to do so. Obviously, sometimes we are forced to take chicks away from the parents at a younger age in order to ensure that the quality control on our hand-feeding lot is done and performed on sufficient number of birds. But there can also be medical reasons why we're pulling these chicks away from the parents. But it is not natural. But in all the different techniques that are natural, we feel that it is not any different than spoon feeding. And the nurturing is not dependent on the time required to feed the birds. We really rely a lot on the early parrot education, the preening of the chick. And nurturing the birds can be done just by examining the birds for a longer period of time. It's not necessarily related to the feeding of the birds, in our impression, for sure.
Since the syringe feeding technique can be so easy for a skilled handler, there is a risk of burning the crop if the food is not monitored, the temperature of the food is not monitored.
Absolutely, and I believe that the trauma caused by this thermal burn, it can be much more severe than if you were feeding with a spoon. When we're feeding with a spoon, the birds would be spitting it back at you if it was too cold or too warm. But when we're feeding with a syringe and accidentally the food would be too hot, then unfortunately, because we're aiming it at the back of the esophagus and it enters the crop with much quicker rapidity, then of course, the bird would only show us the symptoms and the reaction once the food has been fed. And therefore, you would definitely need to be very skilled to notice the symptoms associated with that. And then, of course, empty out the crop and deal with the emergency treatment with the aloe vera, of course, and perform what needs to be done to minimize the damage that has just been done. But definitely, everything associated with things being so fast and easy can definitely have a lot of negative concerns associated with them.
Exactly. There can also be a concern with actually feeding too cool. There can be a slowing of the crop function. Yes,
and because we're stimulating the feeding response of the chick with our fingers, with warm water on our fingers and pressing on the commissures, then of course if our food unfortunately becomes too cool, it will still be fed at that temperature because the bird will be giving us the feeding response.
Exactly.
And therefore we need to be very intuitive to that too, and then of course we would have to empty out the crop with a tube and refeed this bird, or else the complications of the crop dysfunction, because it's got a delayed motility, can be somewhat of a health concern for sure.
Beak deviations and trauma are two other concerns that may be associated with syringe feeding, especially if the hand feeder is using an improper technique or if the improper syringe is being used.
Absolutely, and despite a lot of denial from breeders in the past that beak deviations were associated to improper incubation temperatures or humidity, a lot of the deviations that we see are definitely directly linked to our hand feeding technique, either the pressure that we're putting onto the beaks of our birds when we're syringe feeding them, or the fact that we're using syringes that are just too big at the tip.
Exactly. We have some syringes here. Some of them have the really long tip. These would not be recommended.
No, this particular one actually had the tip blunted and then rounded to prevent any injuries, but it was just to demonstrate that if unfortunately a hand feeder only has access to very long tip syringes, then they can shorten them, but they have to make sure that they round the tip off, because this can be very dangerous and cause a lot of trauma as well. For sure, we're talking now about the deviation, but the trauma can also be something that can cause a severe health concerns, because often it's hard to look inside of the oral cavity of the birds, and if we're not intuitive and we don't notice that the bird might be feeling pain, and spitting back our food because they're just not comfortable, then we might miss it. But definitely these long tip syringes at Harry are not used. No, we've completely thrown them out of our nursery. What we like to use instead is the 20 cc's with a very short tip. Now a lot of breeders laugh at us, especially when we have a few macaws in the nursery, because we need to have sometimes up to 8 of these per macaw. But we prefer to use this because it guarantees us that we're not contributing to the beak deviation.
If it's a very slight beak deviation, it can be corrected though.
Yes, and that's really important that you mentioned, Suzanne, because a lot of people unfortunately are not as intuitive to notice the deviation, or they just feel that they cannot do anything about it and that when the bird is later, they can have surgery done to correct it. But definitely just with a little bit of physiotherapy, then we can correct that. Very important also, we have these discussions in our nursery that the more hand feeders that we have, it seems that the less problems we have as well. So different hand feeders will be applying pressure to the beak to keep it aligned a little bit differently from each other. And this can also minimize then the risk of having these deviations.
Feeding tip adapters on the syringes are something that we do not use at Harry, but I think we need to discuss them.
Yes, we choose not to use them because we rely a lot on our hands stimulating the feeding response when we're applying pressure onto the commissures. This is a health indication for us. On a daily basis, we need to monitor this. Therefore, we don't feel that there's a need to introduce something further down into the mouth to feed, such as a feeding tip adapter.
Right. If you do not get the feeding response, though, we have to evaluate what is going on with the chick.
It could be a multiple. Yes, absolutely. The temperature of the chick, like you said, the environment, the brooder temperature could be off, either too warm, too hot. Maybe there's an environmental stress. If there's no motility, in addition to having no feeding response, then we can be very sure that perhaps there's an underlying health concern as well.
Right. Some of the dangers that are associated with these tip adapters include the fact that the chicken swallow it.
Yes, and this would require surgery to remove it from the crop.
Yes.
Because it's not something that we can actually siphon out or pull out even with a crop tube. That we will use to empty out a crop that may be sour, or if we have delayed crop emptying time, we may be needed to remove some of the food, and then we would use these lawn catheters to remove food from the crop. But the smaller tips that are attached to a syringe have such a higher risk of being ingested because they are so short, and when the bird has a strong feeding response, he inadvertently will ingest it.
Right. It can also cause trauma within the mouth.
Yes, we believe everything that can be ingested further down or inserted further down into the mouth has a potential risk of causing trauma for sure. And then of course, higher risk of aspiration as well.
Right, because the food can come back up and go into the trachea.
Yes, exactly. So definitely there's several reasons why we try and stay away from them. Actually, we don't even allow them into our nursery, but we know of a lot of breeders that have success with them because they are very skilled. But it's important to share some of the concerns. A final one, Suzanne, is the thermal crop burns that can potentially occur.
Exactly. Again, it's the same thing. When the food goes down, it can come back up again, and it can burn the mouth, it can burn the crop.
Exactly, and if the tube is inserted directly into the crop, then the bird won't even have the reaction of showing us that the temperature is too hot, because it won't even be inserted, it won't even go into the esophagus or the mouth. So by the time the food is all emptied out into the crop, then the bird will have some kind of a reaction, but you might be too impressed to move on to the next chick to notice it, for sure.
An additional concern of syringe feeding is that because it's so convenient, hand feeders are tempted to continue this throughout the weaning process, and this can lead to some difficulties, right?
Yes, the laziness is then becomes both for the caretaker and for the bird, because the crop will not downsize in time for the fledgling days, and also the crop will not learn how to start grinding down some of the extruded diet or the foods that he's going to be eating. So it's not a good thing, and it's one that sometimes when we're a little bit overwhelmed as well, and maybe there's more babies in the nursery, we're more tempted to prolong the syringe feeding of the chicks, and then we're delaying the onset of the weaning stages,
right,
which usually happens in the first stage, right?
Right. Another issue with the syringe feeding is that the chicks don't really get to taste the food, and this is important for the weaning process.
It's very important, especially since our extruded hand-feeding formula is the same as our extruded weaning Tropican granules. So it's important that the bird makes the association with the taste. and that we start a combination of both syringe feeding and spoon feeding when they're in the first stage, so that they also learn to associate that the food is coming from within the cage while we're spoon feeding versus from a caretaker that is syringe feeding this bird. So this is really important, the taste and of course the association of where the food comes from for sure.